Every year, more than 500,000 youth attend just over 200 school districts in Connecticut. As many as 1 out of every 5 school-aged youth and adolescents suffer from a behavioral health disorder or substance use. Only 20% of all children with diagnosable behavioral health conditions receive treatment.
When you think about students, they must be connected to learning in order to be successful. And anything that disrupts that connection negatively impacts their outcome.
They're teaching a lot more than just academics in schools these days. To have a solid emotional intelligence, for the school to play a part that can help them further develop those skills, is going to benefit them in the classroom and it's going to benefit them in life.
Thank you for calling Youth Mobile Crisis. How can I help?
Mobile Crisis is a responsive and high-quality service to call when a child or adolescent is experiencing a crisis.
Mobile Crisis Intervention Services bridges the gap between children and the support services they need in their communities. Mobile Crisis is a free confidential service available to children up to the age of 18 who are in crisis. Services are provided by our community partners throughout Connecticut. Anyone with concerns for a child or adolescent can contact Mobile Crisis by dialing 211.
By calling 211, if there is a situation where we need somebody to come out immediately to the school to assist or to assess a student situation, they will certainly come out. They'll also follow up with counseling. They'll work with the family.
With the passing of Connecticut Public Act 13-178, schools are required by law to set up a memoranda of agreement with mobile crisis providers.
So we've really seen a tremendous growth in the utilization of mobile crisis by schools. In 2011, schools represented about 30% of referrals to mobile crisis. And now we see schools are the primary referral source to mobile crisis services and represent nearly 50% of the calls that we receive.
This really unique and close relationship with schools and mobile crisis is so critical because schools are where the children spend the majority of their time. The school staff are the ones who notice when there's a behavioral issue that hasn't been there before, that stands out as unusual. And the perspective that the school staff have is really unique to these youth.
If a child has a PPT or a 504, we can support them. They're not in it by themselves.
It is a win-win for all of us. When we have a generation of young people who can go through our educational system despite their challenges and can come out on the other side successful, productive citizens, that really is what we want.
Mobile Crisis by Design is an immediate short-term intervention, and the long-term goal is that through diverting and avoiding using the criminal justice system or the emergency departments, that we can immediately connect youth and children with longer-term outpatient mental health intervention.
We're helping people who are having probably one of the worst days of their life. If it's a crisis to you, it's a crisis to us. It's always okay to call 211.